Hello, my name is Claudia Bertigay. I'm with Divine Home Care Services, and I'm here with our guest, Daniel Doherty, today with NuCara. He's the development manager there, and we are having a little bit of a problem with the mic, so we're going to be sharing a mic today. How are you doing?
I'm doing great. Thank you for having me today, Claudia. We really appreciate it being here.
Well, thank you so much. NuCara does infusion therapies, and so many of us can benefit from that, whether you have a medical condition or trying to get better. We can get antibiotics and a whole different range of medications through infusion therapy. So Daniel's going to tell us a little bit about what they do and how they do that.
Great. And yes, NuCara is a specialty pharmacy in Austin, and one of the therapies that we offer is the home infusion therapy, and that's what I'd like to talk to you a little bit about today. So infusion therapy is a referral-based therapy, meaning your doctor identifies the problem that you're having, and a lot of the times they'll be able to treat the problem with IV infusion medications. And for a lot of people, this sounds really scary, but what we try to do is we try to take that fear factor out and really let the patient understand how it is safely administered in the home, and we have the tools that can help you guys with that. We have educators that go out to the home and talk to the patient about the equipment they're receiving and just how to operate the equipment. And today I brought a few examples of the different administration tools that we use. She's holding an Eclipse pump in her hand, and this is a self-administering pump that you just hook up and you unclamp it, and it infuses the medication on its own. Very simple to use, very simple to teach the patient on. We also have a few different types of pumps as well, but if you need any of those infusion services, we can definitely help make it an easy transition for the patient.
That's wonderful. And I was asking before we started this, how is it that we can administer these infusions into our system? You were talking about portals, if you can speak a little bit about that,
Yes.
Or people who don't have a portal.
Right.
How does that work?
So there's a couple of different ways that we can infuse the medication. One being the port, and that's a lot of times you'll find your cancer patients will have a port because they get so many infusions, and you don't want to have to stick the patient over and over. So there's a port access. There's also a PICC access, which goes through the arm, and that's also a more of a permanent line that stays in anywhere between 6 months to a year. But if the patient doesn't have that, we can also do a peripheral access, which is more of a temporary line to get those medications through. That typically stays in for a few hours, at max about 3 days.
Well, wonderful. That's great. And do you go out? So you were also saying a little bit earlier before we started this talk that if you can send a nurse to do these services, but also people can, if they're in a place where you're not servicing necessarily. I mean, you service all of Texas, but you could also ship out their medications or their infusions.
That is correct. So we do go all over the state, and so if a patient is in a more rural area or maybe hard to get to, we are able to deliver those medications out to the patient. And so we offer several different types of delivery services to be able to service those patients. Now, sometimes a patient will also be identified if they're going into a clinic to get these infusions done. Sometimes that drive back and forth once a week or maybe once a month gets a little bit too much for them to do. So that's another option. We can take those therapies that they're going into the clinics to get infused, and we can actually infuse in the comfort of their own home.
And what type of therapies do you do? You mentioned cancer patients. What other types of, therapies?
Yeah, great question. We do a wide variety of therapies. Now, we don't do any chemo agent therapies. However, we do a lot of your biologicals, IVIG products, factor products for hemophilia patients. We also offer a wide variety of antibiotics through the IV to treat things like cellulitis and osteomyelitis and things like that. We have a lot of Crohn's disease patients that are on Remicades and Tysabris and things like that. So anything that's a non-toxic agent, we can definitely help out in the home.
Wonderful. Well, thank you so much, Daniel. This is so beneficial. I don't know if you guys found it, beneficial. I surely do. If you have any questions, contact NuCara and or your doctor and see about infusion therapy and how it can help you with whatever ailment you may have. Thank you.